All right, I think we're recording. So with that, I would love to introduce our presenters for today, both from City of Hope. We have Amy Donner and Estrella Barrios, who are social workers in the Department of Supportive Care Medicine at City of Hope. And with that, we will hand it to you both.
Great. And so I think maybe just a little bit about both Estrella and I. As Rachel mentioned, I'm a clinical social worker at City of Hope. I've been here for about 17 years, primarily much of that time on our medical oncology team, and now with our pediatric and AYA population. And fertility has been a topic of area of interest for me for quite some time, both for personal and professional reasons. So I'm excited to spend the next hour with you guys. Estrella?
Thank you, Amy. I am Estrella Barrios. I'm also a social worker at City of Hope. I've been here for about 10 years, primarily working on the adult side for most of my time here, mostly in the hematology setting with transplant patients. And more recently, I have become part of the AYA program, the Adolescent Young Adult Program, and paying special attention to oncofertility and really just assisting our patients and guiding them toward their fertility goals. And yeah, very excited to be here. We have a great presentation for you.
Yeah. And our hope is that this time is beneficial to you. And so if there are questions that you have, feel free to put those in the chat, and we can kind of tailor some of the presentation to those questions. And then, as Rachel mentioned, we will also leave time at the end, probably about 15 minutes, so that we have some opportunity for Q&A. Again, our goal is that it would be beneficial to you and kind of what your your goals are for today. So I'm going to go ahead and try my best. I'm going to do my to screen share and get us started. Okay, so I think we should be good.
Yeah.
Hold on. Oh, sorry, some of the technical stuff sometimes is not my strong suit. So I think before we jump into the topic of specifically of fertility and cancer, I think it's always helpful to kind of take a step back and say, well, what is reproductive health? Because we recognize that actually fertility is only one aspect of reproductive health. So our sexuality plays into that reproductive health, gynecological, urological health plays into that, and then psychosocial issues. So again, just recognizing that fertility is one component of one's overall reproductive health. And in terms of defining fertility, so fertility is defined as the ability to conceive a child. And we know that cancer can either directly affect reproductive organs. So maybe this is cervical cancer, ovarian cancer, testicular cancer. And then the other way that cancer can affect one's fertility is by the effects of treatment itself. So surgery, depending on the location of the surgery, radiation, chemotherapy, immunotherapy. We also recognize that treatment can affect sexual functioning and body image, and all of that plays into one's overall reproductive health. So when we look at kind of the impact, we want to kind of then look at what's the impact of treatment on fertility, and what are fertility preservation options. So when we ask the question, can cancer affect one's fertility? It's important to consider the age of the person, the cancer type, what your fertility status was before treatment, if you're getting chemotherapy, what the type is, the duration, the dose of treatment, radiation, location and dose, if it's surgery, again, type, location, and then immunotherapy. There's less known about some of the reproductive impacts of immunotherapy. But each of those things will play into the impact that the cancer and the treatment have on one's fertility. So for male patients, there's kind of three primary ways that cancer can affect. So For males with a childhood cancer, you may see early, delayed, or absent puberty. There may be infertility, and that can be either temporary or permanent due to a low sperm count, and then lack of testosterone, which is important for sperm production and sperm health. And there's a lot of information on this slide, and I'll kind of reference where you can look for this information if that's specific for you. But when we're looking at different types of treatment, we're looking at, is there at a high risk of impacting one's fertility, an intermediate risk, a low risk, or no risk. And so some of the chemotherapies, particularly the alkalining agents, are known to have a high risk of causing infertility, whole body radiation. And Livestrong Fertility this is where these information is from. And so that's one of the resources that can be helpful if you want to look up specifically, okay, what is the treatment that I have had or is proposed, and how might that affect your fertility? For males, the kind of gold standard is the recommendation is sperm banking if there is a kind of a known risk of infertility. And so that is ideally done before the start of treatment to ensure kind of the healthiest of sperm. For males who have not gone through puberty, there's some research around whether you can freeze testicular tissue. And then one of the standard procedures as part of radiation is, if it's possible, to do radiation shielding to protect the testes. For females, for some females, they may maintain their fertility status, but are actually at risk of going into early menopause because of damage to eggs as part of the treatment. Some females will experience immediate menopause, and that can be both because of surgery or as well as because of medication. Females can have compromised fertility, and so when there's damage to the reproductive organs, that may be temporary or permanent. Females who are closer to the age of menopause are at greater risk for infertility. And then if there's a lack of estrogen, then that can also impact the health of the eggs. So again, a lot of information here, but just kind of knowing kind of high risk, again, some of those alkylating agents, some of the things that have intermediate risk, a lower risk, and then very low risk or unknown. So what typically when we talk about kind of for females, fertility preservation, for females, kind of the gold standard is embryo or egg banking, ideally before treatment. However, if we think back to that idea of that for some females, they will maintain their fertility status, but are actually at risk of experiencing early menopause. And so for those individuals, it may make sense if they are not at the point of wanting to build a family, but are interested in a biological family in the future, post-treatment, looking at egg or embryo banking. Ovarian tissue banking has actually become much more common. And so it is actually less experimental now than it used to. And so that is where they're surgically removing part of the ovarian tissue and freezing it with the hope that then they're able to extract eggs and leading to a pregnancy. And there have been live births that have resulted from that. Sometimes, depending on the type of cancer, and when we're looking at like radiation, they're able to, these are like the ovarian transposition, radiation shielding, radical tricholectomy. Some of these things are actually just a standard part of the treatment planning process for certain types of cancers and certain treatment recommendations. We do want to recognize that there are some special considerations for females that have breast or gynecological cancers. So some breast cancers and gynecological cancers are hormone sensitive, and so standard fertility treatment where you're stimulating the ovaries to release eggs may not be safe. In addition, for individuals who carry the BRCA gene, and they may not want to pass that on. And so looking at kind of genetic testing. Estrella, I'll turn it over to you now.
Thank you, Amy. And you're going to continue to drive my slides. Thank you.
Yes.
I will be talking about just starting this conversation. So there's a big lump of information and education that we hope to spread to you, to our patients, but actually creating the space to talk about it is a whole other ball game. And sometimes it's a bit of a challenge. The ideal, and as Amy had mentioned, the gold standard is that your medical team will bring these things up in the exam room. They will prioritize it before treatment begins, and they'll give the space to actually preserve before treatment begins. However, you as a patient could very much take an active role in this by starting the conversation. If the doctor hasn't started it already, or if you just need more time, you could very much, and we hope to empower you to very much ask them, how will my cancer treatment affect my fertility? You can talk about what's important to you and wanting to have a large family, wanting to have children. And so how does this treatment plan align with your long-term goals? If you have children already or not, it's something that we do encourage you to discuss if this is something that's important to you. And then understanding your options. As Amy had mentioned, there are multiple ways for males and females to preserve. And so understanding exactly what your options are. And then when needed, being referred to the proper specialist. This is a lot of information, like what Amy had mentioned with the high risk and low risk types of treatments. And that is a lot for one person to carry. By no means do we expect you to become an expert and to remember all of this, but to just know that there are specialists that do this for a living. And so just asking your doctor, can you refer me to a specialist so that I can make an informed decision, so that I can understand what my options are and what my future looks like. And the specialist knows all of these things like the back of their hand. And so they will be able to look at your treatment plan and really understand what's the best route for you. We've had instances where I've had the specialist tell my patient, the type of treatment you're getting is really low risk and you're okay to move forward and you wouldn't have to fully do preservation. And so just knowing that green light and having that as an assurance can also settle a lot of distress. Next slide, please, Amy. And this is basically some tools if you guys would like to screenshot or write a few things down of just questions to ask your healthcare team as you're going through the process. Sometimes when you're in the moment, when you're sitting in front of the doctor, there's a lot of emotions, going through your body. There's a lot of questions. There's a lot of stress. I know sometimes when I'm stressed, I could maybe block out things and forget what it is that I wanted to ask. I will draw a blank, and I hear that from patients as well. Especially my young adult patients. There's a lot of respect and admiration that goes to our physicians. And people that are in charge of your medical care. So it's not always easy to insert yourself and ask questions like, will any of these treatments affect my fertility? Or how long do I need to wait after cancer treatment to start my family? These are things that sometimes they might be important to you, but you might miss the opportunity to ask them because you just forgot or you were stressed. So writing these things down, or if you come to appointments with a caregiver, a partner, a friend, giving them this list or highlighting things that you want to make sure to ask so that the doctor could address them. And the doctors will, sometimes on their own or sometimes just with a little bit of probing from you. Then the next slide is going to go over fertility testing specifically, and I'm going to discuss the male side of fertility testing. And this is the bulk of my role here at City of Hope. I am the AYA program specialist and also a fertility navigator. So as I continue to mention, it's a lot of information, and we do understand that this information is brought to you in the middle of a new cancer diagnosis, in the middle of taking leave from work, in the middle of symptoms and feeling like crap. And then someone's bringing up this fertility notion and things to do to plan for your future when you're still trying to plan for the next 24 hours. So my role is to take some of that off of your plate and to walk you through getting connected to a specialist, going as far as making that first appointment for you. For males, the process is a little bit more streamlined because just the anatomy and biology of males. And this is the list of the ways that you could preserve. As Amy had mentioned, the gold standard is usually sperm banking. And so semen analysis is one of the ones that we are most, that we do at City of Hope. Everything aside from this is separate, and we refer out to the community for the most part. I think we do actually take care of sperm function testing as well. But this is a list of things that's essentially your options as it pertains to fertility testing. And one thing that I do like to mention to our patients is we are aware too that the financial piece is a huge component. And so we will usually recommend when you are banking your sperm and there is the coverage of cost for 1 year storage, depending on the type of treatment you get, you could fully continue to do a semen analysis once a year or every other year just to see what the sperm functioning is. And if there are sperm there, how healthy they are, what the mobility of them is before you continue to pay for storage, pay for the bank. And then of course, the hormone testing, urinalysis, and genetic tests are some other options. And these are things that your specialist will walk you through and kind of point you in the right direction. Next, I'm handing off to Amy. She's going to dive into the female portion, which is a little bit more cumbersome and involved.
Yeah. And I think both Estrella and I have found that probably one of the most common questions that we get for young adults after treatment is over is, well, what's my fertility status? And so I think kind of just highlighting this is some of the testing that can be done to get a better sense of what your fertility status may be. So some females may continue menstruating after cancer treatment. Others, their period may stop for a period of time. However, having your period and fertility are not necessarily connected. You can still be, again, you can still be having your period, but actually not ovulating, or there are times that you've started to ovulate, but your period hasn't started. As I mentioned before, cancer can induce early menopause. And so this is where kind of continuing to assess your fertility, current fertility status could be helpful because that may help you make a decision if you're not at the point of wanting to build a family, but are wanting to have that as an option in the future. Then there may come a time where you say, you know what, I'm starting to show some signs of early menopause. Maybe I need to go ahead and do fertility preservation now. So some of the blood work that can be done, and a physician is the one that orders this, is your FSH levels, your estradiol levels, and AMH levels. And so they'll give you a lab slip and kind of time when those labs need to be drawn within the menstrual cycle. An ultrasound, a vaginal ultrasound can be done to look at follicles, and if appropriate, a gynecologist can look at the health of the uterus, the cervix, the fallopian tubes. So those are just a few of the tests. So connecting with your physician is important to get some of these things tested if that is a question that you have. Sorry, give me a sec. There we go. Now I want to transition us into parenthood. And I really want to set the stage as we we want to recognize and really celebrate that there are lots of ways to build families. So there are single parents, there are people that step into that role as a step parent or as a godparent. There may be same-sex couples. You may have a lot of children. You may only end up having one child. It can be a blended family. And so really, again, we just want to recognize, acknowledge, and again, celebrate that there are lots of ways to build a family. It doesn't have to be what we might call the kind of a traditional way of building a family. And each of those different ways are beautiful and have a lot of gifts and blessings that come out of that. So for males, again, kind of going back to that, a semen analysis is going to be helpful to determine kind of current sperm function. And then based on those results, you may have the option of a natural conception. You may seek help from a doctor using either fresh sperm, banked sperm. So if there's like low sperm count, then that may be helpful. The option of donor sperm, a gestational surrogacy, depending on who your partner is, and the option of adoption. For females, again, those hormone tests, ovarian ultrasounds. The other is some of the chemotherapies can affect heart function and lung function. And so a gynecologist will also be looking at that to determine, is it healthy for you to carry a pregnancy? So some females, they will be able to conceive naturally. So if you're at risk of early menopause, but you're at the point of you're like, yes, I'm ready to build a family, then you may be able to conceive without assistance. Fertility preservation would be an option if you're not ready to build a family. Working with a doctor, again, working with that reproductive endocrinologist. So it's whether if you have previously banked embryos or eggs, ovarian tissue, using donor eggs, donor embryos. And I will say maybe kind of on this note that what I have heard kind of from folks that have used both donor eggs, embryos, and sperm, that the child is just as much yours, and kind of that sense of connection, being able to carry that pregnancy. Some folks will elect to use or need to use a gestational surrogate, and then adoption. So with compromised fertility, then there may be needs to, again, work with a reproductive endocrinologist to determine what the best option is for you. If you're looking to have, to achieve it through your own pregnancy, but also these options of gestational surrogacy and adoption. I think a few tips for our male patients. As Estrella mentioned, not all cancers or cancer treatments affect your ability to have a child. So talking with your oncologist about your risks, consulting with the male reproductive specialist, option of sperm banking. It is, again, it gives you that, if you're able to sperm bank, that gives you just more options in the future if that's what you choose. In general, physicians will recommend that you wait 6 to 12 months after chemotherapy or radiation before trying to conceive. Sperm production may immediately return for some males. It may take many years, both for males and females. Even if you've had treatment that has a high risk of causing infertility, we always say if you are not wanting to become a parent, then you should use contraception. We can tell you plenty of stories of people who thought that they, based on their treatment, that there was no way they would ever have biological children, and there they are holding a baby. So, and then I think the other is that often survivors express concern of, would their offspring be at higher risk of birth defects of the cancer? And in general, the answer is no, unless the cancer is caused by some sort of genetic mutation. And that's where genetic screening, genetic counseling can be really helpful. So for female patients, again, not all treatment may affect your ability to conceive a child. Even if your period returns, again, there could be damage to the ovaries. Eggs, embryos, ovarian tissue can be frozen for many years if you're not at the point where you're wanting or able to proceed with a pregnancy. Typically, you're looking at anywhere between 6 months to 5 years. But again, consulting with your specific physician based on your status. Knowing that having your period may not mean that you're fertile. Also, the absence of your period doesn't mean necessarily that you're not able to get pregnant. As I mentioned, that some of the cancer treatments can cause long-term damage to your heart and lungs. And so that's just talking with your doctor about, is it safe for you to proceed with the pregnancy? I think the other area that both Estrella and I get a lot of questions of is, well, where do I go? What do I do next? What are my options for fertility treatment, both before treatment as well as after your cancer treatment? The Alliance for Fertility Preservation is a remarkable organization, national organization that has done really a lot of legislative advocacy to increase insurance coverage. And here is a map of states. So green is good because it means that those states offer fertility preservation coverage. Now, we will tell you it's not as straightforward as it sounds. So California passed in 2019 a bill, so it's Senate Bill 600, that requires commercial insurance plans within the state of California to cover fertility preservation if the treatment if a proposed treatment is known to cause infertility. This law does not apply, the Senate bill does not apply to individuals who are covered by Medi-Cal or Medicare. In addition, if maybe you have an employer plan, but it's an out of state plan, then those California laws may not apply because it's not a federal mandate, it's only a state mandate. So again, this is great news that this law is here, and I've personally worked with patients who have really benefited from this, but also know it's not the most straightforward thing. That being said, if you've got a commercial plan, our recommendation would be to call your insurance. There's a term on here, it's called iatrogenic, I think is the word. It's a little bit of a tongue twister, and you actually have to kind of use that term. I will also say that the reproductive endocrinology clinics they have financial counselors that will also help try and determine insurance coverage for you. So it can be quite expensive particularly for females. And you're looking at both initial cost as well as storage cost. For males, it is less expensive, but there are nevertheless that can be a barrier for folks. And then kind of post-treatment, maybe you're considering donor eggs, donor embryos, donor sperms, and then surrogacy. I think we want to maybe kind of conclude with just a few resources that we have found particularly helpful over the years in our work. So Livestrong has part of their organization is dedicated specifically to fertility. And so they've got some great information, resources, and they provide some financial support as well. And so which is really helpful, and so that can help lower some of the cost if you either don't have insurance coverage or or your insurance does not cover fertility preservation, then that's for both males and females. The Oncofertility Consortium is a network of actually international providers and specialists, and they've got some patient-facing education. So really some great resources. And then Save My Fertility. And then in addition, I wanted to highlight, so the SAM Fund, which is under the parent organization Expect Miracles Foundation, is a longstanding foundation that provides financial assistance to AYAs post-treatment. And one of their grants is for family building. Because again, there is both so you've got the fertility preservation kind of cost, but then depending on kind of what options you're pursuing, there's the cost of family building. So just knowing about this resource, it opens a couple times a year, so just being able to kind of look into that. And I think that is us. So I'm going to go ahead now and stop sharing. And if you have questions, we would encourage you to unmute yourself or write your questions in the chat.